Hi, this is Mary Pat Whaley, and this webinar is ICD-10 CM, getting started today. And I hope after you complete watching this 25 minute video that you will be ready to get started if you have not had a chance yet. I probably will be shortening ICD-9 and ICD-10 to I-9 and I-10, and I'll only be discussing the CM version of I-9 and 10, which is what physicians use, also related to Part B of Medicare. I will not be discussing ICD-10 PCS, which is typically used by on the hospital or the facility side, Part A Medicare. What we are going to be talking about is your ICD-10 action plan and digging down into the crosswalk of ICD-9 to ICD-10 and some tools that we use. Later on, we will be producing additional webinars about documentation and denials. And documentation will be probably in the next month or so. Denials not until October 1st. And note, if you had not heard, a recent CMS announcement is giving physicians, not facilities or hospitals, but is giving physicians 12 months to get used to ICD-10 before they start denying claims based on level of specificity. And so we don't know a lot of specifics about that, but we will certainly be posting on the blog once we get more information about what being in the right code family actually means. Make sure you've spoken to your billing company or your billing software, PM software, EMR, EHR vendors to know when, if yes or no, and when your system will be I-10 ready, and exactly what that means to be I-10 ready. For some systems, they're just loading I-10 and they've made it possible for you to use I-10. But really what we're looking for is any crosswalk capabilities, either 9 to 10 or 10 backwards to 9. Keep in mind that there's not a one-to-one correlation for the majority of codes that are 9 to 10. It's much easier to go backwards from 10 to 9 because there's a multitude of codes in 10 that will fit with one 9 code, but it does not work the other way around. Make sure you know when your software is going to be available, and hopefully it will be available very soon. You don't want to just be able to start using October 1. You want to really understand how it works as soon as possible. So the first thing we're going to do is collect your top ICD-9s, and I give you about 5 different ways to do that. And probably the number one way and the ideal way is for you to run a report direct from your practice management system, or ask your billing company, or from your there may be a report from your EMR. And you want all ICD-9s used in your practice in the past 12 months. Again, ideally based on utilization from the most used at the top to the least used at the bottom. So you can look at that utilization and decide how many you want to actually crosswalk. Most people are going to say 25 at a minimum, but depending upon your specialty, it may be 50 or it may be some more. So also, if you have a multi-specialty practice, or if there's a lot of variation in what your individual providers see as far as problems in their practice, diagnoses in their practice, you may want to run individual reports by the practice or by the individual providers. If for some reason you cannot do that, but for some reason you can run diagnosis lists based on your favorites or your pick list that's in typically in the EMR, do that, or take a screenshot of that, or contact your vendor to find out how to get those favorites or those pick lists. If you're using a super bill, a paper super bill, and it's been updated recently with the most used diagnoses within the past year or so, you can use those ICD-9s on your super bill. If you can't find a way to run it from your practice management system and you don't use a super bill, check with your National Specialty Society, the ACC, cardiology, the AAP, pediatrics, internal medicine, orthopedics, whoever your providers, whatever society your providers belong to or association they belong to, and look on their website, but also call them to see if they have a list they can provide to you. And if all else fails, you can go to the internet. CMS has a website called roadto10.org, and they do provide some top diagnoses for some limited specialties, and I have them listed there. Primary care is listed because of the numbers of primary care physicians and providers, as well as how broad the number of diagnoses, the types of problems they deal with their patients. And then orthopedics and cardiology are pretty widely considered to be the specialty that is most impacted by ICD-10. They also do have some top codes used by other specialties, pain, asthma, diabetes, and so forth. And so you can use roadto10.org to collect most used ICD-9s and then probably work with your physicians to see what they think are the ones that they use the most. So you certainly can sit down with books, with ICD-9 and ICD-10 books, and do your crosswalk manually. There's no problem with that. It might be, if you haven't had any ICD-10 training, it might be a little difficult because things are moved around quite a bit. However, I think a better way to do it is to use an encoder. And an encoder is software that stores the codes we use for services and for diagnoses, and gives us the ability to map them back and forth. An encoder also sometimes helps you to scrub services and diagnoses for billing rules, coding and billing rules, to make sure that you have the best chance of sending in a clean claim. Some encoders are built into practice management systems, although I haven't seen that many. Most of them are available at quite a price for hospitals and very large organizations. But for us smaller guys in practice, there hasn't been as much available at an affordable price. We have found one that we really like and really use. We've been kind of tracking this company for the past couple years to see what they come up with. It's called Swift Audit, and the ICD-9, ICD-10 crosswalk piece is called Swift Audit Search. We just think this has a lot of this is really the best of a book in an electronic format, and I'm going to show you how we use it to get our ICD-9s. So I'm sorry, our ICD-10s, our I-10s. So 250.00 is probably one of the most ubiquitous I-9s used today in most practices for diabetes mellitus. And the search box at the top of Swift Audit is always, like a search box on most other software, the way you start digging down into getting your ICD-10 code. Now, getting an ICD-10 code is kind of like peeling back an onion. There are multiple layers. You're going to kind of start with a 3 or 4 digit code and then go on to 5 or 6 or more codes. So we want to approach it in a way that's going to give us the broadest amount of codes to work with. But I wanted to start with just putting the ICD-9 in to show you what happens. And you can see at the bottom of the screen in green, it shows you that this is an ICD-9. You're going to see the 10s in blue, which I think is a nice distinction because I like to see 9s and 10s on the same page. That's one of the things I really like about this program, because some of them that I have seen won't necessarily show them to you on the same page. So 250.00, diabetes mellitus, found it right away. I want to bring your attention to this little box over here, because this drop-down box gives you an opportunity to put in an ICD-9, an ICD-10, or show ICD-9s or 10s or both. And I always choose both. When I clicked on the 250.00 that came up, I got a page of information, which is really great. This is when I clicked on the diagnosis code, and right away you can see, because it knows I probably want to know what's going on with 10, it shows me two possible crosswalks with 4 digits, E11.9 and E13.9. And it gives me some Medline Plus information on the bottom, which I think is especially great for beginners to have more information about the conditions that we're trying to code. I like to actually start, instead of putting the 9 code in, I like to actually search by the condition. And this is more like the way you would do it with an ICD-10 book, where you would go look diabetes up. So I typed in diabetes in the search box. As I said, it will either take codes or text, and you have this choice to have 9 show up only, 10 show up only, or 9 and 10. In this case, diabetes, it's going to give me some building blocks to help me bring the huge category of diabetes down to more usable information. So each of these little building blocks, if I would check one of them, it would add that building block up here and give me more information. I also can get the index results, which is very helpful, because if you've studied ICD-10, you know that conditions can appear in several different categories. So we have E11.9, and we also have R73.09. And if you've studied I-10, you know the R's are the signs and the symptoms. This is what happens when you choose the ICD-10 only. And this is what happens when you choose both. As I said before, I like to always keep that choose both on there, because it's very helpful for me to be able to see what I maybe would have chosen in 9 and what's available for me to choose in 10. I clicked again, let me go back there. I clicked again on one of the codes to go to expand to more information, and I just happened to pick gestational diabetes mellitus. Brings me to my big information page. So we're going from a list to a big information page. You can see here is the main category, 024, and here we've gotten it down to 024.4. But there is something wrong, because I've got a specificity note here. I've got a little explanation that says there's a code in this family that's more specific. Check next code section, and here are your next codes. And so there are 3 more specific codes that you can use for gestational diabetes. In addition, it's telling me that the weeks of gestation is going to have to be known. And it gives me a note about this being applicable to maternal records only. So this is my first set of information, which is quite a lot. Then I forgot to point out these builders right here. We have notes, use additional code, excludes 1, excludes 2, and inclusion term. And again, if you were in the book, you would see these this information attached to the codes. So I cut and paste what it showed for each one. The notes, the use additional code, you can see it's underlined when it's open. Excludes 2, and inclusion term. So all of this is doing kind of your coding work for you in terms of telling you everything you need to know about this code. So these are these great 5 coding helpers. So let's try another one. Fatigue is another very ubiquitous reason that people come to, or diagnosis, and or reason that people are going to come to see different kinds of specialties, different kinds of physicians and medical practices. And so 780.92, let's just pretend that's the code I got out of my ICD-9 list, and I'm going to look for my crosswalks to 10. So as I said, instead of typing in 780.92, I'm going to type in fatigue and look at all my little building blocks here. These are like little bricks. I think of these as like little building bricks. And when I clicked on my index results, you can see at the bottom I got 3 choices: F, R, and F for combat signs and symptoms in the R category, and operational fatigue. So that helps me to say, oh, where am I going, and can take me right to the code. So when I clicked on the fatigue, I got many choices that I could relate to. 4 possible chapters: R, T, M, and O. And M is a category that I work in a lot for musculoskeletal. I love that section starts with that letter, because it helps me remember it. And we actually have fatigue fractures here. You can see we have some 9s coming in here that we could follow. And then we also have our signs and symptoms. What's very important about this category R, the codes that start with R, is that a lot of physician offices are going to use signs and symptoms just like you do today in ICD-9, because you don't necessarily have a diagnosis when you see a patient, the first time you see a patient. Someone may come in for fatigue and you may not know what is really going on, and so you order some tests. So one of the big things we find is people are confused about unspecified. And unspecified, there are 2 different meanings. One, that it's not a specific enough, or there's not enough information. And the other is that the code is not as specified as it needs to be. So you kind of have to keep those 2 differences in mind. So here we go, R53.82, I chose chronic fatigue, and you see there's that unspecified word I just mentioned, but this is a full code, so this is acceptable. And of course, we're going to use all our helpers to make sure we've covered everything. So if we're talking about chronic fatigue, unspecified, we don't know what this chronic fatigue is, then this is enough to crosswalk. But you want to look at all the fatigues, because in 9, the physicians didn't really have to choose anything specific. So you want to look at the other fatigues and consider whether those are codes that you're going to use. Don't forget, you're going to start with one group of codes in October 1st, and then as the docs start really using them, it's going to become much more refined, and you're going to pick up more codes along the way. One more example, pain 78909, and you can see I typed in abdomen. I did not type in pain, I typed in abdomen, because we're going for site first, not condition. That's quite different than I9. I10, you're going for the site first. So this may be somebody with abdominal pain, but I'm going to look at abdomen first and then use my building block to add pain. And here I've got 2 examples, pain localized to the upper abdomen and pain localized to other parts of the lower abdomen. This is where this laterality comes in that you've heard so much about, where you have to say left, right, bilateral, upper, lower, upper right, upper low. You can see the next code, specificity, there's your exclamation point, and we've got upper abdominal pain, unspecified, right upper, left upper, and epigastric. So upper abdominal pain unspecified would be used when you couldn't actually tell if it was right or left. This is one case where that unspecified, if you can't localize it, would be appropriate to use. And again, here's your notes to give you more information. I further specified to right upper quadrant pain. And the nice thing is here, you can always backtrack to go back to, these are your little breadcrumbs to where you came from. See the major category, and then more specific, and then most specific. And I have talked about a crosswalk. So what does that mean, or what would that look like? You may have different ways that you would want to do it. My brain thinks in a spreadsheet format. I use a lot of spreadsheets, and so I just made up an ABC practice crosswalk that shows me what 9 is going to cross to 10. And I used specifically cluster headache, the 339.00 and 01 and 02 in I9 for episodic and chronic, and crossed them over to cluster headache and other trigeminal autonomic cephalgias. I think I said that right. Or TAC. Easier to say TAC. Cluster headache and TAC. And just to show you how many we have possible that would relate to the 3 we're looking at under I9, you can see it: episodic, chronic, intractable, non-intractable. So, and there's a lot of other things related to cluster headaches. When you look at that, you're going to see a long page of possibilities. So I just did a little snippet to show you what your crosswalk might look like. Now, once you've crosswalked, what are you going to do with it? Well, you're probably going to create some cheat sheets depending upon if that's what your providers like. Some providers really like customized cheat sheets or customized super bills based on what area the patient's being seen for. You can certainly do that. You can preload your new favorites or your pick list in your software. Just make sure you're not going to wipe out I9 if you do that before October 1st. And what I really suggest to help your physicians is to sign them up for the software that I just showed you. You can get a 30-day free trial. You can to do your crosswalk, but then you can also give it to them for them to start playing around with and seeing how 9 crosses to 10. I think it's extremely user-friendly. Physicians can see it on their phone or tablet, iPad, whatever, and I think they will really understand. They'll kind of get it about how 9 and 10 relate and how they want to start thinking about using the 10s. If you'd like more information, either about crosswalking 9 to 10, please feel free to contact us. Our page for ICD-10 on Manage My Practice is just managemypractice.com/ICD-10. And there is a form on that page to send questions, or you can call or you can email directly to abe@managemypractice.com. Also, I hope you'll sign up for an email that tells you when we publish new content. I hope this has been very helpful for you. I hope you can go and sign up for your trial encoder. Use it to crosswalk to 9 and 10. Let your physicians play around with it and get started right now learning what you need to do for ICD-10. Thanks so much for joining me.